Hi, my name is Cynthia Colarusso, and I'm here today to discuss with you appealing to tradition related to the medical profession. I am a critical care nurse of 20 plus years, and so I decided to start my presentation with a story related to appealing to tradition within a medical setting. So many years ago, I was a newer nurse in the cardiac care unit, and a man presents 10 out of 10 chest pain, writhing in pain, massive heart attack happening. We're trying to stabilize him. He's not doing well. He's sweating. He's kind of rolling all over the bed in discomfort. His family's, got a lot of high emotions happening, and the situation is not looking good. He needs intense intervention, and at the facility I was working at, that wasn't available, so he needed to be transferred as soon as possible. And every second for this gentleman counted. It was, grave to lose minutes. So I put a phone call out to the transfer physician on call, and the response I got was, "I'm sorry that we need to stabilize this man, and we transfer in the morning, we stabilize them, and then move them out. That's what we've always done. That's what works here, and that's the way it is." So that would be the perfect example of appealing to tradition in a medical situation, which is truly inappropriate, but is things that happen. Something a little bit more relatable for an everyday person would be the common cold. So if you have the common cold, your mother, your grandmother, your friend might say, "Oh, let me make you some chicken soup. It'll make you feel better, help you get rid of your cold." Okay, that's a common fallacy. A cold is a virus. Chicken soup does not cure a virus. So it may make you feel warm and fuzzy inside, make you might feel a little bit better, fill your tummy, but the common cold is not cured by chicken soup. Very common fallacy. Another one, much older, would be you have a sore throat, and your great grandmother, because it's a really old one, might say, "Oh, take some rock and rye and swish that around and swallow. It will be beneficial for your throat, and your throat will feel better." Unfortunately, if you have strep throat, rock and rye is not going to do anything for you. And for those of you who don't know, rock and rye is ice and rye whiskey. So the only thing that's really going to benefit at the end of the day is you may just be drunk and go to sleep so your throat doesn't hurt, but you will wake up in pain again. You just need an antibiotic. So that's a very common fallacy and a tradition that has been used for years. So my point is, you're all educated adults. These fallacies exist. These traditions are out there. And my goal is to make you understand that critical thinking and logical reasoning plays a huge part in avoiding appealing to tradition when it's inappropriate. So I want to discuss what appealing to tradition is, how it is, when it is appropriate in the medical field, and when it's inappropriate in the medical field. So I just want to start out by talking about what is appealing to tradition. So appealing to tradition is following a belief without question. So it's always been done that way, and that's the way it is. Historically, it's always worked. Why change it? It's really unnecessary. It's worked. That's how we're going to do it. So Bo Bennett, who's a PhD, had published a book called Logical Fallacious, and in that he talks about traditions going from generation to generation, and how there's no explanation to these traditions. There's no rhyme or reason. It's just always done that way. So another supportive definition to what appeal to tradition really is. Now, secondly, we want to talk about, so now that we know what appealing to tradition is it appropriate in medical care? I mean, do we consider it to be safe? The answer is no. Appealing to tradition is never safe in medical care, unfortunately. Sometimes appealing to tradition works in medical care because of default. So, for example, if you have a situation where, say, you have an infection and you go to the doctor and they say to you, "Okay, we're going to put you on penicillin, and that's going to get rid of your infection, and you're all good. It's fine." Now, penicillin was the first antibiotic ever made. It's been around for hundreds of years. So, appealing to tradition, they've always ordered that antibiotic. Maybe that actually is the best antibiotic available for what you have. So yes, that actually by default, even though they're following it because, well, they've always done it that way, that could still very well fall into the category of the best and safest effective treatment. But critical thinking and logical reasoning says, well, this has been around for a really long time. Are you sure that this is the best option for me? You know, medicine is an always evolving, ever changing entity where you have development of new drugs, new research. It's constantly evolving every single day. So there's nothing wrong with standing up and questioning, is this going to be the safest and most effective treatment for me? And, you know, sometimes the answer will be yes. And traditionally, it's always worked. And traditionally, it's going to still work. And sometimes the answer will be no. So, and William Harpin had written an article in 1993 about appealing to tradition and the likelihood to that it's easier to follow tradition when you're in a stable environment and there's minimal variation that's been tested and it still works. Okay, so basically what he's saying is this appealing to tradition situation has been tested and it still works, so we're still good. Okay, and that is something that can be supportive to that default. Now, my third point is, when is it not appropriate? Okay, when is appeal to tradition not appropriate in medicine? And I can guarantee you, almost always. It's really never appropriate. Critical thinking and logical reasoning completely takes over, and it is an expectation of you as an adult, a brother, a sister, a parent, whatever you are, that you step out of your comfort zone and present yourself to be an advocate. Okay, question that. Question, are you doing this because you've always done it that way, or are you doing this because it's the best choice? This is the best and safest treatment for me at the time. Okay, so again, William Harpin in his article says that no people should consider themselves wise if they're following tradition and they're not using logical reasoning, if they're not using their intellectual resources to support following these traditions. So say you have developed this heart condition and your parents say, oh God, I've known this cardiologist for 50 years and they're amazing and he knows everything. So you go to this guy, he says, oh, you need to be on a blood thinner, you have this cardiac condition, we're gonna put you on Coumadin. Coumadin is a very old blood thinner, a lot of high risks with that medication. And you say, okay, you know, I guess that sounds good. Now, right there is an issue. You need to say, is that the best option? Is that the best treatment? Has anything else come out? Is there anything else developed? Because in all actuality, there are generations of blood thinners that have come out since then that are low risk and much better, Pradaxa, Eliquis, all of these things that are available to you if you are willing to take the step to not follow appealing to tradition and step outside of yourself and ask those critical questions. Because sometimes you'll find that medical professionals, you know, especially older ones that have been practicing for a long time, are set in their ways a little bit and they want to use what they're comfortable with. So if they're comfortable with one thing, they might not want to learn how to prescribe a new drug or how that works or what I have to follow if you're on that. You know, sometimes they use what works for them because it's been working for the past 30, 40 years, and that's okay. So this is my point, is that appealing to tradition is just not really effective when we're talking about managing medical care. Critical thinking, logical reasoning, a must for safe treatment for your lifespan. So, in conclusion, I'm going to say that I don't feel that appealing to tradition is appropriate to follow in medical management. I think that questioning your treatments are always a great idea. And as you're all educated adults, It's absolutely your responsibility to step up to the plate and put those questions out there for your safety. Back to my story. So many years ago, I'm in a ice cream parlor with my daughter, who I think was 2 years old at the time, and she was. We were waiting online, and a couple of women come up to me, and they're asking me, "Is your name Cindy, or did you work here at this time?" And blah blah blah. And I'm answering them a little reluctantly because it's kind of weird that they're asking me this. I have my daughter there, and they're strangers. And so they continue on by sharing with me that their father was a gentleman that came to the cardiac care department having this huge heart attack. And they wanted to thank me for stepping outside of what was tradition in that environment and forcing a hand in transferring that gentleman that evening to a larger facility. Excuse me, because this gentleman ended up having quadruple bypass surgery that evening and survived. And he found out that if he had never gotten there that evening, he would not have seen the morning. So, applying these questions and putting them out there, even when you're uncomfortable, is the best option. Always. Questioning, thinking about it, reasoning, beneficial. Appealing to tradition, not really a great idea in medicine. It can save your life to put that question out there. So thank you very much, and I hope you guys learn something that'll help one day. Take care.